All right, good afternoon. Welcome to your weekly Facebook Live here in St. Clair County. My name is Justin Westmiller. I'm the director for St. Clair County Emergency Management. And with me today, as always, I have Dr. Annette Mercatante, the St. Clair County Medical Health Officer. Let's get right into the data. Today, totals to date, 9,812 total cases, with 540 hospitalized, 253 deaths with 8,526 total recovered. Changes in the last 7 days. We've seen quite a increase, 698 total new cases, 99.7 average new cases per day, 391 average cases or average tests per day, and unfortunately we're seeing 15% positive on those tests. You can see we've seen a massive spike up in the last 7 to 10 days, and that's that increase you see right there. Our percent positive, this is our testing screen. You've seen this for a really long time, and you're seeing the results there. This is our vaccine data. You're going to see this continue an upward trend now, and I think we'll talk about this a little bit later on, but we've started our what we're going to call mass vaccination clinics, where we're doing upwards of 2,000 at least per day in the county. So that's really good news. And as always, you can pick up our dashboard at stclaircounty.org/offices/health/COVID19.aspx. All right.
All right.
Let's get to the questions.
Okay. Dr. Mercatante, would you mind going over your talking points? Do you have those in front of you?
I do not have them in front of me.
Okay. These are just regarding scheduling appointments and a pre-registration update. Justin, do you have those in front of you? Because I can do them if you do not.
I can go over Dr. Mercatante if you'd like. So
okay.
As far as scheduling appointments, remember to answer your telephone when either the health department or Kroger Pharmacy calls. The number for the health department will be 810-987-5300 or 586-697-8341 or 8340 for Kroger. And please check your spam folder for any emails, as the emails may slide over there if your email system isn't used to getting those emails. Also, for pre-registration update, every clinic we hold, we're prioritizing the 65 and older, just so that we can make sure we finish that group, even if you're continuing to pre-register. So we recently pulled a report manually, and a lot of those were no answer or listed as an incorrect number or went straight to voicemail. So please make sure that that if you haven't heard from us, send an email to us at covid19@stclaircounty.org. And please also go back into your Everbridge account and make sure all your information is correct in there.
And Justin, if they do have a voicemail, what we found too is people didn't have it set up, so it wouldn't allow us to even leave a message.
Yeah, that's important too. Absolutely. As Jen said, please go in and if you have the capability, set up a voicemail so that we can leave important information on your voicemail.
Okay, and then Justin, again, I'd like you to talk to the audience today about some talking points on our COVID testing and then about vaccine appointments in general on your sheet.
Sure. So you've seen, as I just talked about, our testing percentage is up to 15%. Anytime it gets above 10%, we know that that's troublesome. So please, it's very critical that we get that testing done. Anytime anybody's not feeling well, we urge you to go and find a test. So the health department in St. Clair County offers testing Monday through Friday at 1168 Gratiot Boulevard in Marysville. Appointments can be self-scheduled on the health department website at scchealth.co, or you can call by phone again at 810-987-5300. We are also, obviously I spoke about our mass vaccination clinics, and we're receiving more and more vaccine every week. So you can sign up for those on the health department vaccination sign up on the same website. And you'll be getting phone calls or emails. If the phone rings, make sure you press 1, 2, or 3. 1 will affirm that you're ready to get your vaccine and you accept that time and date. 2 will put it off and say to the system, I don't want that time, but I want to go back into the queue for the next time. And 3 will tell us, I don't need a vaccine anymore, and please delete me from the queue. So it's very important that you choose 1, 2, or 3. All right, and as far as vaccine eligibility, it's very quickly expanding in the next few weeks. So on the 22nd of this month, so on March 22nd, 16 and older with a medical issue, a severe medical issue, you will be eligible for vaccination. And then on April 5th.
One more on March 22nd.
I'm sorry?
On March 22nd, anyone 50 and older as well on March 22nd as well.
Okay.
And then April 5th.
50 and older with just wide open 50 and older.
Yep.
And then anybody 16 and older with a serious medical condition, you are eligible for a vaccine. And then as of April 5th, everybody 16 and older, just with no issues, just wide open, you are eligible for a vaccine. So that will be very good news. And please go on the health department website and sign up to get pre-registered for those vaccines.
Thanks, Justin. Okay, we'll start with some questions that came through last night. Dr. Mercatante, with cases on the rise again, is there a certain age bracket hit the hardest or a certain activity that is causing the increase?
Yeah, I would have to say yes. We've been looking at this data very carefully in the last few days, and there is quite a bit more cases in the 10 to 18-year-old age bracket than we have ever seen before. So what we did is we compared when we were having similar cases, when we had a similar slope, an increase in cases to this, and it was, by the way, just before November, just before we got the big spike. And we looked at that age demographic, and then we looked at the age demographics now, and there is a significant difference in the younger individuals that have cases. So we can put that together. I know what we're experiencing here at the health department with case investigations is that we're seeing a lot of student athletes and students that are doing extracurricular activities, and they're really not paying much attention to quarantine and physical distancing. Now, they may be wearing their masks, but there is a lot of cases happening. So we do have a concern that this latest drive is being driven by our younger people.
Okay, thank you. Justin, question for you. How many people were vaccinated at the Blue Water Convention Center last Saturday at our clinic?
So last Saturday at our clinic, we had a little bit above 500, so right around 535 people vaccinated. It was a really great showing.
Thank you. All right, Dr. Mercatante, are we seeing a change in the demographics of those admitted for hospitalization?
Yeah, they're a little younger. So again, it's a little harder in a small community like ours. There is more hospitalizations, but it's still low. It's still within what the hospitals are able to manage. But I think we've gone from 4% to 13 or 14%, and definitely a little bit on the younger side. And that would fit with who's getting infected right now.
At just the average age of individual hospitalized with COVID dropped to 57 years old in March from 63 years old in February as well, on a side note. Okay, Justin, how can I successfully make an appointment to receive the Johnson & Johnson vaccine? I am a woman of 57 years old, soon to be 58. Please give me all the details I will need.
Okay, so currently we can't pick and choose which vaccine you can receive. We have to be very careful. It's not a, I want to take this one, but I don't want to take this one. They're all very effective against both death and severe disease. So we want to make sure that our community understands that we take whichever one is available at the time that you come in for the clinic. So they've been all rigorously defended coming to market. So it's important that our community understands that.
Thank you. All right, next question. If my son had the COVID-19 virus in the past, does he still need the vaccine? Also, my husband and I had both our vaccines and have family members that refuse to get it. Do we still need to wear a mask around them? So two-part question.
So in regards to natural infection, we still advise people who've had a natural infection to get vaccinated because we don't know how long that immunity lasts. We're still using a cutoff of 90 days for people who've had a natural infection. But that may change over time. But generally speaking, if you've recovered from a COVID infection, you should be vaccinated. As far as wearing a mask, if you've been vaccinated, I would say it's not time to take our masks off. And I think if you have a small group of people in your home and everyone's fully vaccinated and you know who they are and you know where they've been, and that's the kind of situation the CDC is recommending now that you can take. But if you're with people who haven't been vaccinated, if you're with people who are continuing to be in higher risk situations, working in congregate settings, etc., I would just urge you to keep your. I would just make that as much progress as we're making with the vaccine, and we are making great progress with the vaccine. We are simultaneously seeing a huge increase in cases. And if we don't beat this virus back with the vaccine, if we don't get a lot of people vaccinated in a very short period of time, we're going to still be struggling with a lot of disease, a lot of pain and suffering with this virus surging back the way it is. So this is not the time to let down your guard, people. Just hang on a little bit longer. And remember, outside's best. Being with a group that has been fully vaccinated is great, and I would continue to keep your distance and keep your pods, your groups small so that you're not mixing a lot of people from different households together.
And Jen, if I may add to what we're seeing now is the groups that have been vaccinated more, that disease is being pushed more to the groups, obviously, that haven't been vaccinated, and the numbers are really showing that. So it's important for our public to know that at this point. We're very much seeing that.
Okay. The next question from last night, are you concerned with the increase in cases at the high school level?
Of course.
Yeah. Yes.
That's what we're talking about. Yes. Because what happens at the high school bleeds out into the community, right? The virus doesn't care that you're a high school student and you're in this place. You go out, you do things, you go home. So I think this is where we're seeing the overall general community spread. Did you have something to add, Justin?
I do. We're talking to the superintendents each week, right? And they know and share our concerns with the cases that are rising. And like Doc just said, we're working hard to follow the distancing protocols and the masking protocols, and we're working to enact some of these vaccine issues that are coming up here in the next month or so. So consistency with following those protocols is key, and we're partnering with them to work through all of that.
Okay, thank you. Somebody else asked, and you sort of mentioned it before, Doc, but maybe you can elaborate. Can you explain why the period for vaccinated people to not have to quarantine is only 90 days from their last injection? I've heard a lot of people state they won't get the shot now that they've read that. Yeah. That's discouraging.
Well, they established that at the beginning because the data was still being collected, and they wanted to make the exemption for quarantine consistent with the disease one. So I just mentioned if you've been sick with COVID, and by the way, that has to be a confirmed case in our system. We have a lot of trouble saying, oh, I had COVID, and they went and got a serology test, and those aren't the things that has to be a confirmed case in our system. That being said, there is, in fact, a change in CDC policy that it just came out. I found out about it yesterday, so I apologize. We're just still talking about it, but the CDC has extended exemptions for quarantine after you've been fully vaccinated, period. So no end date. So that is changing now, and it's changing because we have more data to support that answer.
Okay.
So that's good news. That's good news.
No end date, you said. Okay. This person asked, I'm unable to leave my house. Are there plans to arrange vaccines for shut-ins, people who can't leave?
Yes. Yes, we are working closely with Council of Aging and VNA and the Visiting Physicians Group. And we're trying to find a variety of plans, not only coming to the home, but also drive-through vaccination clinics. So we're very busy working on that. Now that we have enough vaccine and some community partners, that should be coming shortly. I can't tell you exactly when we'll be ready, but I think we can get there pretty quickly.
And now we have a vaccine that's safe to transport, right? The first two are not exactly safe to transport too.
Here's a great example why we don't want people saying, I want this vaccine and that vaccine. We know that a 2-dose series works very well in the setting that we have at these big community-based clinics, right? You get your first vaccine, you're told when to come back. That's working well. In fact, of the vast majority of people are getting their second vaccine. The Johnson & Johnson 1-dose vaccine is uniquely suited for situations where it's going to be hard to go back and give people a second dose. For instance, these vulnerable homebound individuals, people who are being discharged from hospitals. So we are, in fact, going to preferentially use that vaccine in communities or in populations that are going to benefit from a single dose. It's another reason why I don't think at the beginning you're going to be able to just pick and choose, because we are, in fact, going to direct those vaccines in the place that is going to be most helpful to the overall community, right? We want the benefit of the whole community. So that's how we're going to approach it.
Okay. And somebody asked also, with the new cases of variants in our county, do we know if any of those people had been vaccinated?
That's a good question. I don't think so, but I am not 100% sure. I do know that the vaccine is thought to be very effective against the UK B117 variant. So there's not a lot of concern about the vaccine not having as much effectiveness against that variant. What we are concerned about is the variant seems to spread much easier. It has over a 50% increase in contagiousness, which means you could get infected with a shorter period of time, a shorter or a farther distance. So normally we say 6 feet. You could be maybe even a little further and get exposed and still get infected. So this is the concern of the B117 variant. It's just we're afraid it's going to spread more easily.
Okay. All right. Now we're moving to questions that are on the live feed. Where do I get my second shot? It's due March 30th.
Well, you should have been told when your second shot is due when you got your first shot. And we're basically telling people who are getting their first shot to come back in 4 weeks to get their second shot, same place, same time. So if you got the vaccine from us, you're going to be going back to the same place, same time, 4 weeks later. Now, if that doesn't make any sense to you and you're not sure what to do, or maybe you got your vaccine in Florida somewhere and you need a second dose, you're going to have to write us at that COVID-19 at stclaircounty.org, and we'll figure it out for you. We'll figure it out for you.
Yeah. The short answer is if you got it at the convention center, you're going back to the convention center. If you got it at the Marysville clinic, you're going back to the Marysville clinic. If you got it
Correct.
down in Marine City, you're going to Marine City.
Same time, same place. So if you were there on a Friday morning, you're going to go 4 weeks later on a Friday morning. And hopefully that'll work out well for most people. I realize there'll be some glitches, but we'll figure those out.
If someone has a glitch, they can please email us at covid19@stclaircounty.org. Okay, next question. Do you still need volunteers?
Always.
Always.
Yeah. So if, and I'll take that one. So if anybody is willing to volunteer at any time, go ahead and send an email to the COVID-19 email box, and your information will be sent along to our volunteer coordinator, and Pam will get a hold of you.
Okay. The next question was, how many positive cases at Holland Woods School? And Brandon just looked that up, and it was 4 cases. Okay.
So I'll mention again that we actually had a very long meeting today with all of our superintendents. We're talking to them very regularly. They're aware of these issues, and we are going to take steps to try and reduce transmission in all of these locations.
All right, I just want to read someone's comment. Shouting out to Lisa Cobb, woohoo, for scheduling my second dose today. Very grateful. Also to you all for all your hard work and dedication to our county. Those are always nice things to hear.
We appreciate that.
All right, the next one. I registered my son for the vaccine. He got notified, but due to his work location, wasn't able to respond in time. At the end of the day, he received a notification that he had opted out. He did not. How can we reschedule him?
Send us
Ms.
an email.
Joanne, yeah, please send us an email at covid19@stclaircounty.org, and we will work to figure that out.
We'll get them back in. Not a problem.
The next person, you kind of already covered this, but are all appointments now in Marysville?
Well, yes and no. So we are going to do these large vaccine clinics so that we can run, and this is a nice, beautiful site. Well, very well. We feel we can run 2,000-3,000 doses through in a typical day. So that should be able to keep up with what we are. And if we need to, we'll pick a second day. But right now it's Wednesday because that's how much vaccine we're getting. Does that mean we're not going to be doing other special vaccination clinics? No. There's a lot of special settings, situations where people need vaccines, and we're still working on those individually. But for the general public who just, need vaccine, can drive, can walk from their car to the location, we urge you to use that Marysville site. We think it's the most efficient location we've had so far.
Okay. The next question is back on the school concerns. How high are the cases in the schools? A friend's grandchild is on her second quarantine since school started back face-to-face. If they go any higher, is there a chance of the schools being closed for a 14-day quarantine?
Yes.
Justin, someone mentioned that you need better lighting. Oh, and you fixed it. Okay.
I just fixed it, yeah.
Thank you. Much better. Okay. Somebody else asked, any idea why the spike is in the last 7 days? Is it K through 12 or another age group?
It's actually through 12. It's the older age group. And there's a clear relationship with that age group, and I think the spike. Now, and I was talking to Justin about this earlier. Do we know it's a cause and effect? It's not definitive proof, but we have no other variables in our county right now that are guiding us why we're having such a disproportionate problem. I mean, we are spiking. Our cases have gone up 248%, I believe, in the last 2 weeks. I mean, we are one of the highest accelerating locations in the state. And so you go and you look at that, what's different? The only thing we can find that's different is those school age kids. So
Okay.
for now, that's what we're going to focus on and hope it works. You know, we just need to keep trying to put out these fires. So that's what we're going to do.
And like I said a minute ago, remember, this is a virus, right? So it's looking for hosts. And when a lot of the hosts from the beginning of this are vaccinated now, it can't hook up with those people. So it goes to a different group. And the only group it can get to now are the younger people that haven't had a chance to vaccinate yet. So it's going with them. So that's where we are.
I want to emphasize that. So here's the good news. Generally, younger people don't get seriously ill. Like, they can. It's not impossible. But for the most part, these younger people are going to do just fine. If they, in fact, follow the quarantine rules and they follow the guidelines and stay away from their grandmother and from the people who can be more vulnerable, we can prevent a lot of harm. And meanwhile, while we have this big spike in cases, we can get these more vulnerable people vaccinated, so they're not as likely to be hospitalized and to die. So all is not lost, even with this huge spike. It's just people have to do the right thing. You have to do the right thing. You cannot assume that it doesn't matter what you do. It really does matter what you do after you've had an exposure. And we can argue till the cows come home about whether or not my kid really had an exposure, but we do have very clear-cut guidelines of what exposure is like. We err on the side of caution, especially during a spike like this. And if you've been told you had exposure, please, please, please don't be around other people. Okay? You really need to do the work, because it just takes one person going out that ends up converting into a positive case, and then they have then infected a bunch more people. It's like a domino effect that keeps happening. So I'm just begging people to just do the right thing. This is a tough time right now, but if we can get to an area where our population is better vaccinated, we're going to be able to prevent a lot of disease and death, which is really what it's about, people. It's about people getting sick and dying, which is not cool. I don't care if it's 2% or 10%. It's not cool. Okay. I'm done preaching.
Then again, someone was asking too about, is the rise have anything to do with school sports starting up again? So just wanted to.
Yeah, probably.
We talked about that association. Okay.
And I can only say that because I'm just going to say that initially, for the first part of all the spike, it was the athletic teams and the extracurricular teams that were getting the cases before we started seeing the cases in the schools themselves. So I'm assuming that was the beginning of it. Yes.
Okay. The next question, this person had a lot of kudos for the clinic yesterday, and very grateful. So that's nice to hear. But they wanted to know, they have a concern that their appointment for their second dose was scheduled 29 days later rather than 21 days.
21 days.
She said, I realize that the CDC says it's okay to wait, but I also believe that when Pfizer did the trials, they only did the trials and had results from those who received their second dose 21 days later. So she said, Can you discuss this?
I think we're confident that there is not going to be any decrease in your immune response a week later. And there's been a very clear guidance that as long as you're vaccinating within 6 weeks of the first dose of either Pfizer or Moderna, that immune response is very vibrant. Clinical trials being what they will, they are limited, and that's why we use further trials as we go to fill out our information. So partly it's because we really are confident that there's no harm in doing it. But with that said, it's logistically very hard to have 2 different second dose clinics when we're running this 2 different vaccine formulations at the same time. So as you may realize, we used to get like just Moderna, or we get Pfizer and we'd run it and then we'd schedule the second dose clinic. Now we're getting both every week. And so we're just putting those together and using all the vaccine that we have available to us for as much as we can in those clinics, which means it would be a logistic nightmare to schedule some of them 1 days forward and some of them 28. So part of this is just to try and get it done. And I'll just say this, when we do things to improve our efficiency, we are avoiding a lot of error. So it's not just about making our life easier. It really is about providing you care and your vaccine with the minimal amount of error and the minimum amount of and the maximum amount of patient safety. So that kind of goes into it too. When you start doing all that, things can get really confusing very quickly, and that's not a good thing for you. So I would just say don't worry about it. I'm very confident that your immune response will be excellent at 28 or 29 days, even if you had the Pfizer dose.
Yeah, and if I can just add to that too, yesterday was the first day that I spent an entire day at a clinic, and I was amazed at all of the steps it took to make the Pfizer vaccine available to put into arms. You know, there's mixing requirements and shaking requirements and all these things. So there is a lot of room for vaccine error, and what the nurses do there is amazing. So, I'm thankful that they're as safe as they are to make sure that our community is as protected as they are.
Okay, thank you. Somebody wants you to review the hospitalization rates again.
Oh, do you have those?
Yeah. I don't know if we have if we have it slated, the up-to-date rates, but I know when we did our EOC call the other day, we had, Brandon, what was it, almost 30 people in the hospital between the 3 hospitals? That was pretty close, right?
Yeah, 32 people, I believe, 13%
right.
of beds associated with COVID patients.
So,
so all of our hospitals and some are all reporting more activity, but not anything beyond their capacity. But they're definitely seeing an uptick.
Right, but 10 days ago it was 0. So that's important to know too, is in 10 days we went from 0 to 13% and more than 30 patients. So we are seeing a pretty decent increase.
Okay, thank you. All right, next question. Do you anticipate a pause in schools after spring break due to so many families traveling?
I think there's a potential, yes.
Yeah. And it's really, we are still working with our schools, and I would say that public health recommends certain activities like that, and we are in fact recommending that. What each individual school does is often based on their unique situation, their policies and their parents and their board, but our recommendation is to take a pause. Yes.
Okay, thank you. Just going back to the woman who asked about Holland Woods, our data specialist referred her also back to the schools who can tell her more about the quarantine numbers. Okay, the next question. The appointment sign up for testing on the website says you should not go get tested if you are in quarantine. Is this right?
You should not get, we don't want you to come and get a vaccine when you're in quarantine because we don't want to expose you. But testing, we'll have to look at that, because quite honestly, while you're in quarantine is exactly when you want to get, especially kind of mid-range. Remember, you can't test yourself out of quarantine, but if you're feeling ill in quarantine, we absolutely want you to get tested. Our staff wears appropriate PPE, and there is no risk of our staff being infected. So we'll double check that and see what that's about.
I wonder if they got vaccine and testing mixed up.
Maybe, but we'll double check it tonight.
Thank you for that. God knows we've changed things so many times. It's pretty easy to forget something somewhere. Yeah, thank you.
Very
Keep us
much.
honest.
The next question, it says ward vaccine only lasts 3 months, ? I'm not sure what ward vaccine means. Do you?
I'm sorry.
Okay.
I don't know. I'll
maybe they'll ask again. Okay. The next person says, what age group is getting COVID?
All age groups.
Okay.
All age groups. But we are, as I mentioned, we are seeing a spike, a disproportionate more in that 10 to 18-year-old range right now. But it is across the board.
All right, the next question. So how long are we going to wait and do something before we have an outrageous amount of cases right now? It's getting crazy.
I don't think we're waiting at all.
I'd agree. Well, it always seems like we're waiting. And, in hindsight, it's always easy to look back and say, oh, we should. But, it takes a village to do this. And be honest with you, I'm very pleased with the relationship that we have with our schools and our businesses. I think nothing's ever perfect, but I'm very pleased with the way they're moving forward with this and the communication that we're having with them. I mean, let's face it, nobody wants to stop people from living their lives, right? There's always this conflict of looking at things and saying, for the benefit of human beings, they need to work, they need to go to school, they need to play. These are important for human beings. And then on the other hand, you look at the cases and go, what point is the tipping point where it's getting out of hand? And you walk and sometimes, a couple times, about how it's plateaued. And that, the rest of the state is not going up precipitatively. So there wasn't a lot there last week, I think. We were concerned. We were very concerned and watching it closely, but we weren't spiking the way we are this week. It happens very quickly. And all of those risks have to be considered. And I'll tell you what, it's really hard as a health officer to say, stop doing everything when you don't have the absolute data to prove it. And so that kind of delays things too. You got to convince people, which changes the paradigm. So I understand what you're saying. I hope we get way better at this as we move forward so that we can find those little signals and jump all over it. But as a society, we're really not there. We don't like to jump over on anything. We don't want to change.
Okay. The next question, with the rise in the community, would it be a wise decision for vaccinated elderly seniors, late 80s, to not be going into restaurants at this point?
Yes. I would say yes. Remember that no vaccine is 100% effective. So there are people who've been fully vaccinated that are still getting sick. At the very best, it's 5%, so 5 out of 100. So I would say, given the rapid increase in cases right now, I would recommend my 80-year-old grandmother or whatever to pick some carryout out and bring it home and eat and enjoy your dinner with your safer group. When anytime you go in a restaurant and you have to take your mask off, you are going to be more at risk, because when you eat and you have your mask off, there's just more ability for that virus to transmit.
Okay. The next question, could you please post the phone numbers and the contact names that will be contacting you for the vaccine?
Can I post the phone numbers and the contact names? Oh, yeah, Jen, I'm talking so that they feel that they're not getting spam calls. Could you do that? I don't have that.
Sure.
We can certainly post that.
Yep. And Justin, you had mentioned at the beginning of the call too, I believe, that the phone number will come across as the health department number. And if it's from Kroger, you had read those numbers off.
Yeah, I can read them off again real quick.
Okay.
For the health department, obviously it's going to be 810-987-5300. And for Kroger, it's going to be 586-697-8341 or 8340.
Okay. I can only imagine an increase of cases after spring break. What warrants a pause in the school districts?
So we are recommending a pause after spring break. We're also recommending that people don't travel. If you're going to travel, it'd be nice if you got tested first, right? And when you're there, don't go to large congregate settings, all the things we know that are more risky. We are recommending that people come back and retest. And we are making arrangements for several pop-up testing resources to be available at the end of spring break. And we would like as many people as possible to take advantage of that. We can test a lot of people on those 1 to 2 days, and we're going to do it hopefully before people return to school. So so you have the testing, you have just the physical distancing, the mask wearing, you're doing your due diligence of where you're supposed to go. And finally, we are recommending that you take a pause, that 7 to 10 day break after you return. And that's what we're trying to talk to the schools about. Some of them will be returning, I believe, right after Easter, but the testing piece I think is still very valid. And I think it's something everybody should consider doing, especially if they've been traveling. I worry about the travel, quite honestly.
Okay, somebody asked, any thoughts on doing vaccine clinics at the high schools after April 5th?
Yeah, we have talked about that a little bit.
Okay. Who do I contact when I'm trying to log into the vaccine registration and I'm not receiving a password reset email?
COVID-19.
Yep.
COVID-19 at St. Clair County. That is your go-to stop for any problem that you're having with COVID-19. Questions, vaccine issues, the Everbridge glitches, just put it all in there, and then we can separate that. We can send it to different people who can manage those issues.
All right, thank you. How does an 82-year-old that has not been vaccinated and just recently went into a long-term care home get a vaccine?
So the long-term care facilities are all being charged to kind of come up with a different plan. The original plan of vaccinating everybody with the pharmacies, that's kind of been done. They got their 3 visits. So they need to ask the facilitator. We do have pharmacies that are still vaccinating. There's a variety of options. I think none of the nursing homes have really settled on one standard approach, but I agree with you. You should get vaccinated and you should push that. Maybe even if you're mobile, just coming out, as I mentioned before, we'd like to do some drive-through vaccine clinics. So maybe if you get those up and about, you could take somebody from a nursing home setting and just bring them out and get them vaccinated. But I strongly.
All right. When can I get a shingles vaccine if I get a COVID vaccine?
We recommend waiting 14 days between this vaccine and any others. It's really honestly not been studied, so I would wait at least 14 days.
All right. Do you see us going back to new restrictions if the cases continue to rise?
We got to do something. Yeah, we can't just throw up our hands and say, oh, well, we got a bunch of people dying again. So yes, we have to think about what we know works. We do know that personal behavior works. You know, after Christmas and that New Year's break, cases came down. And I think that's because once people got their visiting done, they came home and they settled in. So there's that. I think the vaccine is going to be very helpful. And I think hot spotting that vaccine is going to be important. And as far as businesses and restaurants, that's a little trickier, but we'll see where we go. It really depends on where we go.
Okay. If we get registered on the site, do we just wait to get called, or are there other opportunities?
You
take every opportunity. Yeah, take every opportunity to sign up wherever vaccines are offered. Don't just sign up on ours and sit there and wait. Sign up if you're a customer at Kroger, sign up there. If you're a customer at Meijer, sign up there. If you're a customer at Rite Aid, sign up there. Sign up everywhere you can. You know, if you work in Holland County, go ahead.
I just want to say too, we're starting to see some vaccine going to our doctors too. So ask your doctor as well whether they have any access to vaccine, because we're continuing to see more and more access as we go.
Okay. How long after your first or second dose of the vaccine can side effects be experienced?
Usually it's in the first 24 to 48 hours, but could probably be up to 5 days. I'd have to look at the clinical trials again, but generally speaking, you're not going to see side effects from a medication much beyond 5 to 7 days.
All right. You already covered this, but why are those who got their Moderna shot last Saturday not returning for their second shot for 5 weeks, April 17th, instead of 4 weeks? And you had covered that earlier as well. They may have tuned in late.
I thought it was 4 weeks. Okay.
What symptoms are kids having that are testing positive?
Kids are not
much the
having
same.
nearly as many symptoms. They can have the same symptoms, cough, fever, body aches, but typically they're much milder, and the kids are much more likely to have asymptomatic infections. Now, the condition we worry about, there's a rare condition associated with COVID infections in children, this multi-inflammatory syndrome that is very serious, but fortunately is extremely rare. So that is a reportable condition with children, but knock on wood, we haven't seen a lot of it yet.
Can you tell us how the UK strand is in this county? Family members living in Italy, that country just shut down until after Easter due to the UK variant.
Here we go again. It's enough to just break your heart, isn't it? So the UK variant is here. I believe we have 4 cases now. One of them's linked to another, so I guess that's good, but none of them have traveled. So I would just assume that we're going to see the UK variant slowly become our next dominant strain. And certainly, I believe there's over 600 documented cases in Michigan alone. And if that's the case, so be it. I'd rather have the UK strain than the South African one, or one of the ones that is showing resistance to treatment. We'll stick with the UK strain, but I don't think there's a whole lot we're going to be able to do at this point to slow that down. If it's that much more infectious, it's just going to gradually become the dominant strain. I hate to say that, but that's my instinct.
Okay. Do they notify
people?
Oh, sorry.
Sorry, go ahead.
Do they notify people on the list if there are extra vaccines on a particular day?
Yeah, we have a whole system that if we end up with extra vaccine, we'll start calling people. So a lot of times people will bring their spouses, or we'll say, bring your spouse back. They do. The nurses are really good about not wasting vaccine. Actually, that's why I got my vaccine yesterday, because I happened to be at the clinic, and hey, Merck, you need it. So I'm doing the body ache fever thing today, but I was grateful to get it right then and there.
All right. School teams are being tested. Would that be the reason the spike among that group, that student isn't playing a sport, isn't being tested?
Well, actually, we've been pushing testing because of the spike. What we want to do is try and identify those mildly symptomatic or asymptomatic athletes and get them out of there before they expose the whole team. So increased testing was a result of increased cases. Some situations we found a lot, and actually some situations we didn't find a lot of extra. So we're going to really be encouraging schools to test all of their teams at least once a week, because it is a very useful tool. It works very well in nursing homes, for instance. We know that if you identify cases earlier, you can do a much better job trying to reduce that spread.
All right. My daughter was vaccinated in Indiana. Her proof of vaccination card has an expiration date listed on it. It's Moderna. Can you explain the date meaning? Second shot was Tuesday and the expiration date is August?
That's the expiration of the vaccine. That means it had to be used before August, so it has no relevance to her. I don't think our vaccine cards are including that. As long as they're not using expired vaccine. No, ours didn't put that on there, but that's what that means.
And we just want to clarify too, please don't come to the clinics without an appointment. If we happen to have the extra, we will contact people, but we really emphasize, please don't come without an appointment. Okay, just had to throw that in there. Let's see. Thank you for the clinics. Does one dose of Moderna give some protection? I was exposed a week later after the shot and didn't get sick, just out of quarantine.
Yeah, it probably does give you some protection. We just don't know how much. Maybe as much as 50%, and some individuals a lot less. So, which is why we're still recommending 2 doses, but it does provide you some protection. So that's a good thing.
Okay.
Don't forget, I'll just say this, don't forget that not everybody who's exposed to the virus gets sick. I believe our quarantine data Oh, this is a Brandon question, but of all the people that get quarantined,
He's on here.
How many % of people actually end up getting sick when they're in quarantine? It's not 100% people. So even if you have a known exposure, that virus isn't, automatically going to infect you, especially if you're doing things like, wearing a mask and washing your hands and getting rid of that virus.
It's between 15 and 25%, Doc.
There you go.
All right. Why would a student who received a positive rapid but then a negative PCR still have to quarantine along with all the kids they caused to quarantine? I thought PCR was more accurate.
Yeah, the PCR is more accurate, but you also have to take into consideration the risk situation. If a person was exposed and there is a high risk of infection because of the exposure, we consider a rapid antigen test to be confirmatory. Remember too that none of these tests are perfect. You can have a positive antigen, and if you don't do that PCR quickly enough, which detects the actual genetic material, it can come back negative. So you got to kind of just use your head a little bit. These are not black and white scenarios, and those situations where we have a high level of suspicion or concern, we'll err on the side of caution and use the tests that we have, even if they're not validated with a confirmatory. If that makes any sense. I hope it does.
Jen, real quick, can I answer something? So
yeah,
I just got Liz just texted me the Moderna 5-week question from a couple questions ago is because there is an event at the convention center that's forcing us to do that, to push that out one extra week. So that's why they're waiting 5 weeks on that.
Thank you. I didn't understand that. So yeah, again, logistics, vaccinating 2,000 or 3,000 people is pretty complex. So every once in a while, things will get adjusted and shifted a little bit. But we would not do it if we weren't confident that it didn't increase your risk in any way.
So this one person keeps asking about the Holland Woods situation with the quarantine, and I'm not sure how you want to approach that as far as what we should tell her, how she can find out those numbers.
Yeah, I don't have those at the tip of my head. And quite honestly, we are not getting to every positive case. When we're getting we have 160 new cases today. So we are prioritizing cases. We are sending a lot of cases up to the state. We have this new system called PEG, the Patient Education Genius, which hopefully will help with some of that burden. So please, if you get a text or an email, fill it out. That helps us a lot. So the cases in schools, as well as the quarantines associated with them, are probably your best bet is to talk to the schools. They are sharing them with us to a certain extent, but we kind of talk more broad generalities like, are you seeing cases that you think could be transmitted with in-person learning versus a kid that comes to school who's sick because their mom and dad is sick at home? They have kind of a different connotation. So I would refer you back to the school, the school principal or your superintendent, and see what they're coming up with.
Say mom had a question about some concern she was having about one of a local medical facility. If you have a complaint about a local medical facility, who should you contact?
Probably us. They can be reported to MyOSHA as well, and there is a link on the MDHS website.
Okay.
But if you send it to us, we have relationships with all of our doctors, and a lot of times what I'll do is I'll pick up the phone and I'll talk to those offices and find out what they're going, whether they need education or what they need, and then if we have repeated issues, we can go further up the chain to Laura, the licensing bureau, or to MyOSHA. So I would say bring it to us. And that would be is it COVID-19 again? Is that the complaint? Is there still a complaint link on our website, Jen?
Yeah, there is.
Took it down or not? Okay.
Nope.
There you
go.
Up. So there's actually a link to submit a complaint about a business. Put it there.
All right. Next question. I was supposed to go for my second dose last Friday afternoon. My son quick tested Friday morning positive. Needless to say, I had to quarantine, so I couldn't get my second dose. Is this going to affect the coverage of my vaccine when I do get the second dose?
No, because your quarantine is going to be 10 days, and as long as you get your second dose in that 6-week period, that extra 2 weeks, you should be fine. I got to tell you, these criteria are based on the clinical trials, the phase 3 trials, which is the best we have. There are 43,000 people that are in these trials, so they're good trials for safety and efficacy, but we have not seen a vaccine yet, and all the vaccines that we have, that aren't effective if you're a little late in getting it. So I want to reassure people, I would be very surprised if a week late or a few days late in any way is going to impact your immunity with these vaccines. Like I said, I could be wrong, but it would surprise me greatly. I don't know of a single vaccine where that is really an issue. They all work great if you're late on getting it. So what I would do, since you have that gap and you're not a flu, I'd be careful, try not to get exposed during that period of time. So you're in quarantine, and obviously if you feel ill, get tested to find out if you converted as a result of that exposure. But in the meantime, since you're not fully protected with your vaccine, just be a little extra careful during that time as well until you get your shot.
All right. Next person says, great clinic yesterday. I have had a metallic taste in my mouth. Is that okay?
Probably from your vaccine. We see all kinds of mouth taste, smell things. I as long as you're not having any difficulty breathing, having any kind of symptoms related to being not be able to get up or walk or function, if you're having neurological changes or breathing changes, those are things you should definitely seek help for. But if you got a little different taste in your mouth, I don't think that's an delayed anaphylactic problem. Now, if your mouth starts to swell up and your tongue starts getting swelled up and you're having difficulty swallowing, that's a different thing. I want you to go to the hospital for that. But it's a little bit more extreme than that.
Somebody asked, when will vaccines be open for younger folks in their 30s? As we mentioned before, March 22nd, anyone 16 and up with a medical condition will be eligible. And then April 5th, anyone 16 and up. So I'll just answer that for you guys. Okay, next one is, why can healthcare workers work while positive and asymptomatic, but asymptomatic kids can't stay in school, nor can the healthy kids that sat next to them?
I'll take that one if you don't mind.
Okay, well, it's a little tricky actually, and actually,
okay.
Healthcare work while they're positive. It kind of depends where they got exposed, if it's a community exposure, a high risk exposure, and also what they do. So based on what a healthcare provider does will limit their ability to work. But it boils down to the fact that many of them work with full PPE and are not in any way, they're contained with their PPE. They know how to control the transmission of that infection and the critical nature of their work. So when we get rocking and rolling with these cases, we start getting into trouble with not having the workforce that we need. Not having enough nurses and doctors is more dangerous than making sure that they work with full PPE, and they generally get reassigned as well to less critical areas and less critical patients. But I do want to say it's not across the board. The CDC guidance for healthcare exposure and quarantine has gotten really complicated, and it's changed. So it does need to be factored in. I'm sorry, did I stop? Is that kind of what you were going to say, Justin? I hope it was.
It is. And the other thing I was going to focus on too is what I ask people to understand, like you already pointed out, is the major difference between medical professionals and high school students is the fact that they're professionals doing an essential service versus a high school student that can still learn from home or virtually, and doctors can't do the same thing. Nurses can't do the same thing. They're an essential service where we have a finite resource of them. So it's apples and oranges, really.
Okay. If you have
It's
your
risk
vaccine,
benefit.
sorry.
Risk benefit, people. It's not like it's A plus B equals C. It's always about trying to consider what the benefits versus the risks are going to be, as well as the likelihood and the statistical amount of impact that it's going to have. So go ahead. I'm sorry, Jen.
Quarantine is not a jail sentence. It is a protective measure to ensure that your loved ones or you don't get sick from something they were exposed to. We've got to change that connotation, period.
Yeah.
All right. We've got several more questions left, and we've already been going for an hour. So just want to let you know where we are at the time. It's 4:30. Okay, next question. When are we going to increase the venues for people?
Well, certainly not when our cases are surging out of control. I would not support loosening any of our harm reduction or mitigation strategies at this point. In fact, it would make, obviously, I think, a lot more sense to tighten them up. So I would not be supportive of opening up venues when we're seeing 248% increases in our cases in a week.
All right. If you have your vaccines, should you get a test after traveling?
So if you've been vaccinated and you feel ill, do test, okay? But in general, if you've been fully vaccinated and you've traveled, I would just self-monitor at that point, and not necessarily test. But I gotta tell you again, if you had a really high risk exposure, you found somebody that you were driving in the car with all the way down to Florida was infectious during that period, I probably would test again, just to be on the safe side. Remember, vaccines are not 100% effective. They help a lot, but they are not 100% effective. So you got to, again, weigh that risk. What's the risk if you are positive and don't know it? Are you a teacher? Are you somebody that's working in a high risk situation? It doesn't hurt to get a test. They're free. They're real safe. And sometimes they can be a little hard because they're interpreted, they're wrong sometimes, etc. But it's still a tool that we should be using a lot more than we are. I got to tell you, I think we should be using testing strategies much more frequently than we are, because it helps. It helps a lot.
The next question is, can you describe what the big vaccination clinic is like in Marysville? Since people are not yet immune, what precautions are you taking to prevent the spread at these vaccination clinics?
Why don't you describe it, Justin?
Yeah, absolutely. So we have taken every measure to ensure that social distancing in every square foot of that facility is followed. The entire facility is queued so that people are placed in positions so that they're not interacting with others that are not in their family unit. Every vaccination station is spread out at least 6 feet. And then when they're in the holding area, they're at least 6 feet apart, both front to back and side to side from every other person. And then, obviously all the way out to parking. So social distancing is completely taken care of. We have monitors to ensure that social distancing is taken care of. And then all of the staff and all of our community is ensured to wear masks and any other PPE that's required. So we are pretty militant in that to ensure that everybody's as safe as possible.
Justin, did you mention too that there's signs outside, I believe, that talk about if you're sick, please don't come in. They screen you for temperature when you walk in the door and ask you some health questions as well.
Okay. Yeah, and please don't come if you're under quarantine.
Yeah, please don't come if you're sick. Don't come if you're under quarantine or if you're waiting for your COVID test results. Okay, any plans for vaccine clinics in the western part of the county?
Yes, we want to get there. We are trying to work with Sanilac County to kind of do a joint clinic there. But if that doesn't work out, we'll get something set up over there. We understand that that's hard to drive all the way down. But for now, if you can drive, come to Marysville, because that's where we're rocking and rolling. And the more people we vaccinate, the quicker, the better things are going to be.
Well, and we have plans with Yale High School too. Once we become overwhelmed with vaccine, we do have plans with Yale and Algonac High School to do additional clinics in those facilities potentially too. But we have such a good setup centrally located in the county that that's where we're working through right now.
Remember too that as a health department, we have to function. We're going to be doing this for a long time, and we need to focus on sustainability. So whatever we do, we need to keep doing it. And meanwhile, public health has a lot of other essential roles in the community. So we have kind of hit on this idea: if we do 1 or 2 large clinics every week and pull all of our staff to do that, it's actually a lot easier on everybody. They do a better job. We can staff it more effectively, so it's a better experience for you, and it just seems to be a better plan than trying to have multiple clinics throughout the week. So we'll see how it works out. And by the way, when the weather gets nicer, we'd very much like to have some I mentioned already, some drive-through clinics, but we can't be doing it in 50-mile-an-hour winds at 20 below zero. So.
All right. Somebody else wants to know, are there different symptoms with the variants than there are with the original virus?
I don't think so.
All right. Somebody wants to know, why don't you mandate that staff and students must not return to school after traveling out of state?
It's probably illegal. Court, I think if the health risk was great enough, we could explore that possibility. And believe me, we do talk about that. But there's a lot of legalities involved with that. For every person that would please, there would be a bunch of people it wouldn't please. And not that I'm afraid of getting sued, but some of these things go into court and they don't do well. And so we just want what's best for everyone, for the students, for the faculty. And I think we can do that, quite honestly, voluntarily.
All right.
Yeah,
why is Michigan?
Right? That is a recommendation, but it's not a legal requirement.
Right. So our recommendation, if you don't test and quarantine, you probably shouldn't return to school until you've had those 7 to 10 days off after you've traveled.
All right. Why is Michigan different than any other states in regard to the quarantine process? Other states are not quarantining kids at all, and schools are continuing on. If this is a problem throughout the West,
aware of that.
Expect that.
I'm not aware of that. I'm sorry. I know somebody sent me a thing from Ohio today that showed alteration of their quarantine process, but I'm not aware of anyone who's not quarantining. It is a tenet. It's the backbone of controlling an infectious disease. We isolate and quarantine for every infectious disease, and it's not likely to change as long as this virus is killing people. So if you're aware of a state that's not isolating, quarantining kids, please let us know. Go ahead and send it to us. I'd be very surprised if that were the case.
All right.
Could be wrong.
I could be wrong. The next person wants to know, when you're saying you're recommending a pause for schools after spring break, does that include elementary schools?
That's a really good question. And there's a mixed answer to that. Quite honestly, there are some elementary schools that are not having any trouble at all. And so, you're tempted to make sure that the kids can stay in school as much as possible if they're not really a source. On the other hand, they're probably going on spring break with their older brothers and sisters and parents like everybody else. So that conversation is ongoing.
All right.
And, and I'll just say this too. So whatever decisions are made, the most important thing is we got to see how well they work. Okay. So when we're making decisions and we are following cases and data, if it's clear that things aren't working, we readjust and we shift. And that is the reality of dealing with something like this that's emerging. Again, I'm going to say that there is not like a cookbook, cut and dried approach to this. And a lot of it is based on what works for our community and what's happening in our community. So we take best practice, we take the guidance that the CDC and the state, and then we try really hard to make sure it's working.
All right. Next person wants to know, her 70-year-old parents are getting the Moderna vaccine. Should they be worried about any bad side effects?
The side effects for both Moderna and Pfizer are about like 50 to 70%, meaning sore arm, body aches. Generally speaking, they're very self-limiting. I would just kind of check in on them. There is a program called vSafe that we really encourage people to sign up for, although for an 80-year-old, I guess they're not tech savvy, but there's a process where if you sign up after a vaccine, people will check in on you as well and make sure that you're doing okay. But I wouldn't not vaccinate based on that. I would just be prepared that they're going to have probably a couple of days where they're not feeling too hot, and just making sure they're taken care of and you're checking on them.
All right. And then I think this is one of the last questions. Well, what percentage of St. Clair County has been vaccinated? I believe that's 20.8% of the adult population has received at least one vaccine. Brandon, I think it wrote that in there.
And for our 65 and older, we're close to 50%. So right. Good, but we're not there yet. You got to keep going.
And then the very last question, besides everyone is very thankful for everything, is that someone asked, if you get COVID, how soon can you be vaccinated if the opportunity is presented? And that's the last question.
You can get vaccinated as soon as you feel better and you're out of isolation. Okay, so with mine, I was sick for a while and I delayed mine close to 90 days with the understanding too that I probably had some natural protection for at least that long. But quite honestly, I wouldn't push it much beyond days because that's when we assume that you might be becoming more vulnerable. So you can get it whenever you're recovered and out of isolation. And now that vaccine is prevalent, I'm not going to even advise. I was saying, well, since nobody can get the vaccine, you might want to give somebody else your turn while you have your own natural protection. But that's probably not really that important right now anyway. So I would just make sure you go as soon as you feel better.
Someone pointed out I missed one question. This is the last question. Are you still reviewing those designated as essential and scheduling them? This person says they're patiently waiting.
Yeah, we are trying to go back every time we have a clinic and pull those people out first, as we are with the 65 and older that haven't responded to us. So we are trying to get back to that so that you guys don't lose your spot. Please, 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 if we're somehow not getting to you, send us maybe the drop down boxes aren't working or something for you, because we do use the criteria that you filled in to pull that. And I think Lisa was saying, one of the ladies that does a lot of our clinics, that there was still about 400 people in the essential categories that hadn't responded. So you're out there. If you're not getting an appointment from us, give us a holler, because we're trying to get to you. And I'm not sure if we haven't, why that would be out, and we'll try and get you in. There shouldn't be any problem getting you in.
Yeah, so Sarah, send an email to covid19@stclaircounty.org, and somebody will check and see where you are on that list.
All right, and that's all she wrote. Closing comments. We went a long time today. Lots of questions, a lot of people watching. Go ahead, Justin, Doc.
All right, I'll go first. I just want to say that I say this all the time. I know you're sick of this. And we're getting a lot of people who are like, why my kid? Why? And the answer, quite honestly, is because we have a problem. We have a growing problem, and we're trying to follow best practices to try and reduce that risk. And yeah, there are impacts from that. We get that. This is a problem that everybody is feeling. It's not just you. I can tell you the number of people who I know that have had severe illness, even deaths in their family. Let me tell you, that's not so cool. So we're all in this together, and I just want to say that we're not picking on anyone because we think that they're an easy target. We're trying to choose wisely, and we're trying to do the things we need to do to control this virus. And we're going to keep doing it until we win. We're going to win. I do think we're going to win this. But it's probably going to still take a little bit of time and effort. So God bless.
Had a little technical difficulty there, and my computer hang up. So, Russ, thanks for putting me back on. All right. Like Doc said, this is we're in one of those difficult moments right now, and I know for a lot of you it doesn't feel like a moment; it feels like an eternity. But as we've always said, we will get through this, and I know that many of you have been quarantined, or know somebody who has been quarantined. Nobody's being picked on. We're just doing our best to fight this terrible disease. And as always, we thank everybody for your patience. This is really hard, and obviously it's not getting any better. Like I said before, we can see that the older portion of our community is vaccinated, it's pushing down to the younger half. So we're going to push as hard as we can to get as many people in our community vaccinated, and hopefully we can move this on just as soon as possible. If there's any questions or anybody needs anything, we're always available to answer your questions. And thank you all so much for joining us every week, and we'll see you again next week. Have a great weekend.